Unfortunately, this pandemic has laid bare some longstanding systemic inequities across our state. We've seen this certainly in disproportionate rates of COVID, but also when we look at the impact, the economic impact, job loss, at even the ability for our kids to be able to participate in school virtually, we see that there are certain communities that have historically been under-resourced and frankly left behind. And so this legislative session, we're very excited that there's a significant focus in both the House and the Senate on health equity. We plan to be very engaged in opportunities to get resources and investments like loan repayment and tax incentives and grants into communities who need them most to really improve the health of that community. But then there's also holding up the mirror, if you will, opportunity within the healthcare space for us to do better. And so we expect to be engaged on legislation that will look at new implicit bias training, at new data reporting requirements and transparency, at a statewide approach that really recognizes all of the non-medical things that impact healthcare utilization. So when you think about health equity, that should not sit solely in the Maryland Department of Health. That is touched with education, with human resources, with transportation, with agriculture. And just as we've done to address the opioid epidemic, we also need to take a similar all hands on deck approach to address health equity and to really right the wrongs that we've seen in this state for so long.